Hi, my name is Zev Wainberg. I am a medical oncologist at UCLA, Los Angeles, California. I'm a professor of medicine and surgery, co-director of the GI Oncology program, and director of the early phase clinical research program at UCLA. Nice to be here. So what kind of impact lifestyle and exercise and diet has to prevent colon cancer is a challenging topic. We do know that colon cancer is more common in the Western world than the Eastern world. And that has prompted all sorts of suggestions that there is a role that diet plays. And most of the studies have suggested that, in fact, that is true. In societies where less saturated fats and less and more, I should say, more fruits, vegetables, fiber-based diets are part of their culture, there is a lower risk of colorectal cancer. And that has prompted many, many studies over the years to suggest that modifications to diet could reduce our risk for developing colorectal cancer. And it's more difficult to say in any individual person, well, gosh, if you change your diet completely, your risk is on a personal level going to be reduced. These are society guidelines, society recommendations, looking at the impact of particular diets, let's say in the United States or Europe, versus diets in other parts of the world. So, for example, we do know for a fact that more saturated fats and more fast food diets do increase the risk of certain diseases, of which colon cancer is on that risk. We also know that one of the reasons is perhaps because obesity increases the risk of colon cancer. So if you adhere to a lower fat, higher fiber, more fruits and vegetables, the so-called Mediterranean diet, you're less likely to become obese and therefore less likely, theoretically, to develop colon cancer. And so these are clear lifestyle diet modifications that have been studied over the years and have, in most studies, demonstrated that adhering to dietary modifications or different diets is a good thing to prevent risk of colon cancer, as it's probably a good thing to prevent a number of other diseases. That's not to mean that nobody can't have red meat once in a while or a hamburger. This is looking at how often or how much we eat at McDonald's or Burger King and have red meat. There's a balance between having, moderation of red meat, which doesn't have any risk of causing colon cancer, versus having it every day and leading to other health problems, including a disease like colon cancer. So that's one dietary modification that has been pretty convincing. And it also, I should mention, applies to people who have had colon cancer and want to reduce their risk of getting another one as well. Dietary modification helps. As it relates to other lifestyle modifications, we know that aerobic exercise, and that means aerobic means not just lifting weights, but walking, jogging, swimming, running, anything that gets your heart rate up, also reduces your risk of colon cancer. So sedentary lifestyle, which is implied by not doing any exercise, is not a good lifestyle to reduce your risk of colon cancer. Active lifestyles, getting out and walking and getting exercise and being active also is something that certainly can reduce one's risk of colon cancer. The other things that can reduce risk of colon cancer are in balance, staying healthy and seeing your doctor and getting vitamin D levels checked, which are probably once in a while a good idea because higher vitamin D levels have been associated with lower risk of colon cancer. So additional healthy lifestyle modifications that have been suggested to increase risk for colon cancer, such as excessive alcohol use, excessive tobacco use, while not absolutely linked 100% of colon cancer. There is a suggestion in most studies that there is an increased risk with excess alcohol use and excess tobacco use to colon cancer. So we recommend adhering to less alcohol, less tobacco. I should also mention that there have been some studies that have looked at the role of aspirin at reducing the risk of colon cancer. Those are somewhat conflicting, and there is no clear, absolute right answer to that question. It depends on the individual risk, and it also depends on a discussion with your doctor about the risks and benefits of aspirin to prevent colon cancer. So we have a series of behavioral and lifestyle modifications that can reduce risk, which include less sedentary, more physically active behavior, more so-called Mediterranean diet and less fatty diet, adhering to less alcohol and less tobacco use. And those are some of the modifications we can all make to prevent our risk of colorectal cancer.